Call to order the Finance Committee meeting for August 24th, 2022. Do we have a roll call, please?
Can't hear you.
Start over.
All right, let me start over. Call together the Finance Committee for Wednesday, August 24th, 2022. A roll call, please.
Mr. Lear.
Present.
Mr. Swanson.
Present.
Mr. Hess.
Present.
Ms. Polk.
Present.
Ms. Weber.
Present.
Ms. Parker. Mr. Fairfield.
Present.
Mr. Eckhoff. Mr. Featherling.
Present.
Mr. Dennell.
Present.
Mr. Miller.
Present.
Mr. Long.
Present.
Mr. Hunter.
Present.
Mr. Raymond.
Present.
Mr. Wheeler. Mr. Searoy. We have a quorum.
I have no request for public comment. Is there any public comment desired? Is there any public comment desired? If there is no public comment desired, we'll move to presentations. Mr. Lynch for the medical insurance yearly review. If you could come forward, Mr. Lynch, we'll look at that presentation. Good morning.
How are you?
Fine. We have two parts to the presentation. The first one's in your packet. The second one has been distributed in paper form.
The cover page of the first report should say Blue Insight Monthly Financial Report. And there should be 7 pages to that. This report starts on January the 1st, 2022 and is through July 31st of 2022. This is data that has, sorry about that, data that has come in, and we have a lag in about 30 some days, so this report is the most up-to-date report we have on the experience in the claimed uses of the plans. First page I have copied and given out here is a enrollment overview, just to give you perspective. You'll see that on a month-to-month basis through July, in July we had 403 medical subscribers. And then secondly in that line is 872 medical members, and that includes the families, children, spouses, and things of that nature. To give you perspective, last July, in July 21, we had 415 members, and so we're down about 12 members at that point in time. In terms of medical members, we had 891 last year, so we're down 19 at this point. The pharmacy subscribers and members are equal to the medical subscribers and members, so that's why I didn't go over those two columns. There's just you know, a small negative in terms of the numbers of bodies that we had last year versus this year. On page 5, you can see over in the right-hand corner, overall membership decreased by 1.1%. Average age was 33.9, which increased by 0.9 between the reporting periods last year versus this year. The contract size, just basically an analysis of who's on as a dependent, increased 4.8. Females between the ages 20 and 44 increased from 19.3% to 20%. And you'll see at another point that I think male versus female in this group is pretty well balanced. You can go over on the left-hand side and see proportions of males. About 48 last year, 48.2. Proportion of females, 51 versus 51.1 versus 51.8, and then a repetition of the 20 to 44 category. Page 6 it gets to what I would call the meat of the matter. You'll see this is a financial summary, and at the top there provides a breakdown of medical order of reduction from the billed to the paid for the current month, period, prior period, and a percent change. Over on the left-hand column, you'll see the number of, or the dollars that were billed. July 2022, there individually was a 903,857 billed. However, on the right side of the page, if you look at January 21st to July 21st last year, it was billed 9,918,853. This year at this point, 7,213,000. So Blue Cross is telling you there's a 27% reduction in the bottom line that's been billed to the plan. So that's obviously very good. Not covered claims, which I would pay more attention to than the not covered. 8,000,009 versus 6,000,003, which is about a 29% reduction. And if you'll skip down to the paid to provider, you'll see that last year in 2021, the provider balances were 2,758,000 versus current 1,856,000. So that's a 32.7 reduction. And again, medical paid down 32.7%. And then there's a group liability breakdown. And here I'll give you some additional information that's not on the page, but you've got 2021 versus 22. But you'll remember back in 2020, we had a really good year. The medical paid up to this point was 1,055,317. In 2021, we see that it was 2,760,000, and right now we're at about 1,858,000. So that gives you perspective on how the claims have come in and what the deviations are. Can be some huge changes depending upon the medical conditions and the amount of high cost claimants that we see. And that's another thing we'll see in a minute, that's down as well. Pharmacy paid, there was in 2020 366,000. In 2021, 632,000, and right now we're sitting on 552,000. So between medical paid and pharmacy paid between 22 and 21, medical's down 32.7, pharmacy's down 12.7. Dropping down to the overall group liability, it is down 28% between 21 and 22. Again, perspective is in 2020 we were at 1,422,000. So all in all, we're sitting on top of a fairly decent year, but we're between, if you look at those three numbers, we're between 2020 and 2022 are the closest best numbers of the bunches. On to page 7, financial overview, and this is what is called the medical and pharmacy loss rating ratio, which is a kind of a key term. This report provides the medical and pharmacy loss ratios and claims for the most recent reported 12 months. And so, as you'll see over on the left column, we've got the months that are being compared here, back to August 2021 through July 2022. And of those loss ratio months, and if you go all the way over to the right side, you'll see medical and pharmacy loss ratios. And there's double digits in every one of those except for 3 months in 2021, October, November, and December, which are kind of typical because you come to the last quarter of the year and people are getting stuff in. And but those are 3-digit numbers. They're above 100%. Without those 3 months, this would look a lot better. But we're sitting on top of 87.5. And again, if I give you the perspective of 2021, we were sitting at the same time at about 108.6%. So again, we are a lot lower. That's a deviation of about 21%. And while I can see the renewals being a lot better, this is kind of a key number right there. Their desired loss ratio is somewhere, and I'll tell you that in specific when I get a chance to refer to it in another report, that is in the right under the 80% mark. So we're getting close to where they want us to be. And last year was just a really, bad year for claims, which COVID was involved in there. Steve?
I'm sorry. Mr. Hess.
Thank you, Chairman. Mike, do you think the first 6 months of last year is still going back to the COVID when there was no selective surgeries done in 20?
There's some of that. There's those surgeries that could be put off, cataract thing, some, and didn't necessarily have to be not important, but some things could be pushed forward, yes, and 21's got some of that in it without question, but you would have expected to see more in the early years of 2022 of that as well, in my opinion, from what I've seen in other places. So I think, the first and part of the second quarter showed up about things like that. I know cataract surgeries were just way off the mark. It doesn't hit just people over 65 either. There's a lot of that. But some of the elective surgeries were put off, and I think they blended into 2021 in a great part, but 22's had some of that in the first part of it. Let's see here. Moving from 7, the next page I would refer to is page number 10. And here there is a layout of medical claims expense. And this is kind of an interesting and important scenario because you'll see in claims less than $5,000, there's, the bulk of the annualized claims in those 3 areas. In the 5,000, 10,000, and 30,000, there's less than 10% of those claims. If you look over at the left, or excuse me, the right side of the column, the paid percentages and the dollar amounts, at this point, $1,697,000 totally paid. In this portion of that represents 91% of the total claims versus last year, which was $1,643,000. So not a gigantic difference, but you can see down at the bottom, you'll see key findings. The proportion of claimants who receive less than $200 in services for the current period was 27%. Those claimants spent about 0.9% of the total paid expenses, and the average paid expense per claimant was $79. 0.3% of the claimants had expenses over $50,000 for the current period. Those claimants were about 8%, and average paid expense per claimant was $80,000. Last year, that number was $233,000. So there's a big deviation in not only, I think there's there's difference of 3 bodies, one year versus the next, but the average claim for those bodies is huge. So if you want to jump to the next page, which talks about the high-cost claimants, You'll see that this report at the top there, it says the report provides a detailed listing of the top 20 high claimants with paid expenses of $50,000 or more for the current period. And then it lists, not by name, but by subscriber, age, gender, and the leading diagnostic category. The subscriber, in all cases, that means the employee, in Blue Cross lingo, transferred to employee. Then it lists the age and gender. First person was up against circulatory diseases, endocrine diseases for the second, and the third one, it was not available, which is not unusual. In many cases, they don't have a specific diagnosis. There could be multiple diagnoses, so that's not listed there. But next to the diagnostic category, if you will, there's inpatient paid, outpatient paid, professional paid, that's, you know, physician, and pharmacy paid. And then we get a paid column. But I'll drop down to the high cost claimant total. You'll see there's 81,184. For your reference, last year at this time, it was 141,622. Outpatient, and this maybe goes back to his question about the COVID and, you know, where some of this lied. Outpatient paid was 55,000. Last year at this time it was 519,000. So, you know, there's an inlier. Professional paid 39,000. Right now we're sitting on last year 45,000. Pharmacy paid 60,110 versus last year at 117,354. So the last year's total, yeah, I'm sorry. Last year's was 800.
Just a minute.
Yeah, I'm sorry, I didn't see it.
Yeah, I just got a question. In terms of the $2,000 cap that was just passed recently, what overall impact, has there been any prognostications as to what kind of impact it'll have on these numbers? In terms
Hunter,
of industry?
I don't know that I can answer that question without maybe asking and taking it to a level at Blue Cross, like in the reporting section, to see if they've got any of that information. I know what you're referring to, but I haven't seen anything like in writing from them. And usually when they have a report that they want to notify brokers and consultants and agents out in the field to watch out for, so to speak, they'll let us know that. But I'll mark that down and see if I can find out.
Yeah, please, because I would think that they would know what the legislation was and the impact it would have on the industry. So if you can get that to us,
yes,
appreciate it.
Be happy to. So between this year at 236, 268, you know, last year's was sitting on top of 824, 448. And then that last column, currently enrolled, I don't mean to demean anybody by this comment, but you're always happier when you see not enrolled than enrolled, and all three of these people are still enrolled. So it's just telling you they're still on the plan and that you may have some claims that you have to watch out for going forward, so financially. And so I think that was the last page. Hang on here. No, excuse me, I had page 14 and 15 marked. Page 14 is the overall medical paid per member per month by leading diagnostic categories. And you'll see over there that health status wasn't even on the list last year, and this is just an evaluation. So the leading diagnostic category is for physicians reviewing the status of individuals. Number 2 is perinatal. Last year that was at 10th. Circulatory is the third leading spot. Last year it was at 5th. Mental health, which we've seen an increase in the last 2 years because of COVID. It sits there at 4th. Last year it was at 8th. Injury and poisoning, which it covers a vast spectrum of injuries and ingestions. was at, let's see, that's at 5, and last year was at 7, and last year's number 1 was musculoskeletal, and this year it's sitting down at 5th. So just to give you an idea what kind of things are going on. If you want to skip over to page 15, we can see the pharmacy financial summary. The comparisons between the 2 years are as important as anything, and you can see between 21 and 22 in the billed area, it's gone down in both billed and covered about 5.5%. The out-of-pocket cost is down. That means out-of-pocket costs for the individuals down 15.5%, and paid to the providers down about 12.7%. I'm not quite sure that 2020 perspective is of much value at this point, but they were significantly less in the 2020 year. At the bottom, you'll see total pharmacy paid versus specialty paid. And you'll see in the prior column, the total paid was $632,655 versus specialty paid $231,736. In the current period, were much reduced, and I believe the 552 was a number that was 12.7 below last year, and the specialty is 147,000. So in both of those categories, it's down, which is good news, but we'd like to see that stay the same over the next, several months, because that's where the true numbers really start kicking in. Even though I'll talk about the renewal here, we've got it. If it stays better, we've got a chance to work that number, is where I'm going with it. So, and I'll stop here for any questions. Andy?
Mr. Wheeler.
I just did the same thing. Knock the top off the mic. The where's trend at right now for the industry?
They've said 8.7 to 9.5.
Okay.
And that's the Blue Cross folks. When you talk to other carriers, they speak sometimes of different numbers, but I haven't heard a number that's vastly different.
Okay. And so, have you heard of an inflationary number in the healthcare sector? We all know what it is in the food and the gas and everything else, but other types of products that you can buy. But what's that number in healthcare?
The numbers we've focused on are the numbers that the underwriters have told us they're focusing on, and that's the 9.5 to 9.7. Okay. I can't tell you that I've heard anyone say of this 9.5 or 9.7, this is what inflation is, because that number we're talking about, Andy, is a medical inflation number.
Right.
That's what trend is. So I haven't heard them say anything different than that, so to speak.
I just see lots of good things happening with the utilization of our health plan.
Right.
We're down in almost every category, I believe. And you haven't announced what our renewal is, but I would like to have that discussion.
Yep. The first thing I'd like to do is go to the executive summary page and what was handed out. It's page number 4 at the bottom right-hand column. At the top left-hand corner, it says executive summary. This tells you what the utilization report really is. Starting at the top, Kankakee County's overall enrollment decreased. And another thing I want to say is this report is for 2 time periods, and that is June of 21 through May of 22, and that's on an incurred basis, claims that have yet possibly to be, versus a paid basis of June 21 through July 22nd. So these numbers won't match up, because that's not the intent of this report. It's to the monthly report, which is, data that's, coming in as we speak. So it's very active data, and this is looking backwards. Enrollment decreased 1.3% between those two periods. The average age among the membership increased from 33.6 to 33.7. So, Mr. Hunter, I think you asked a question earlier about average age. So it's gone up slightly, but nothing of measurable. Interestingly, female again versus male, 51% female versus 48.6 male. The overall paid expense per member per month decreased by 3.5% between those two reporting periods. The service categories that impacted the paid PM per member per month trend the most was inpatient facilities, which decreased by 19.7%, and was lower by 9.7% than the Blue Cross Blue Shield benchmark. Inpatient PM decreased by 19.7, as I said. The surgical portion of that decreased by 36%. Medical application decreased by 42%. So again, it's just applying to what Andy said, that it's gotten much better. Outpatient PM decreased by 11% between reporting periods. The two outpatient facility visit types that were paid were surgical and pharmacy and IV therapy, mostly chemotherapies. That surgical decreased by 13, pharmacy and IV therapies decreased by 38%. Professional paid was increased by 9.4%. Top two service units there were evaluation management, and it increased by 19.7. The medical evaluations and management increased by 24.4. Medical PM decreased by 6.7 between the periods, 6.4 lower than the benchmark. And I think generally when we look at those benchmarks, you can probably say that's Chicago, kind of to the downstate mark, if you will. We're not necessarily centered in the Chicago market land, so you can kind of interpret it that way. Pharmacy paid PM increased by 9% between the two periods. As we kind of looked before, the four diagnostic categories by paid expense PM were musculoskeletal, health status, cancers, circulatories. Those four diagnostic categories accounted for 50% of the overall paid expenses. For high cost claimants, and those are defined as claimants over $50,000, this decreased by 17.9, almost 18% between the two time periods. A number of HCCs also increased by 25% from 12 to 15 during those same time frames. The proportion of paid expenses due to high cost claimants decreased from 31.8 to 27.4. So even there is an increase in bodies, the cost of treating those bodies have gone down. The PM for emergency room usage increased by 27.4% between the periods. ER visits per thousand increased by 38%. And I could go through this utilization period, but I believe I looked at this, and much of the reason was centered in mental health treatment, which is not a criticism, it's just a fact. There was a lot of people coming out of COVID that had a lot of mental health issues, with staying home possibly or what have you. This was about 13.9% higher than the benchmark. In the current reporting period, PCP usage accounted for 38.6% of professional office visits compared to 34% in the benchmark. PCPs accounted for 48.8% of the professional office expenses. So moving on to page 5, this dashboard gives you a key metric scenario up there in the top left hand. I won't go through all of this, but right now in this report, it's telling you that of all of these categories, the overall paid per member per month is going down about 3.5%. On page 7, you'll see that 3.5%, the current paid per member per month is $462.27. Now what that means is if you take everything and throw it in a basket, divide by the number of bodies and so on, that's what the cost is per member per month. Annualize that out, and that's where you come into an average cost annually. The change over last year is about 3.5%, which is about 9.7% lower than the benchmarks. And then if you want to dig down into all of those things, into the individual utilizations, you can see that inpatient, outpatient, professional, and pharmacy, and what it has done in each category. That's why I have these. I don't know why I can't remember that. Skipping on to page 8, key indicator report. Starting on the left side, you'll see again, if you really want to dig down and see what's going on, you'll see inpatient facilities, outpatient facilities, professional, the medical summary, the pharmacy individual, and then the overall summaries. But you can see over there in the benchmark variances versus the percentage changes, we've got a lot of negatives in there in the inpatient and outpatient areas at the top, but the benchmark variances are negatives in inpatient facilities, but increasing when we start looking at benchmark versus where we're at in outpatient. Professionals are at a negative. Medical summaries are at a negative. The pharmacy utilization per member is down, and you'll see in the overall summaries it's under 10%. Over off to the right there, you'll see total medical paid per member per month decreased 6.4% in the current reporting period, and that was 6.4% below the benchmark. Excluding high cost claimants, the total paid trend was 2.8. Let's see, let's skip to page 11. You'll see, I picked this out because there are others in the reports, but on neoplasms, cancers, you'll see that PMPM across between 20 and 21, one's at 396 in 2020 through 2021, 5.35 in 21-22. That's a 35% change. The benchmark is 8.09, so we're under that benchmark about 33%. So if you want to know, yeah, although we think this is a high cost claim area for cancers, and this group in the past has kind of shown that, we're still under where most of those benchmarks are. So to say that we're, have some sort of an outlier, I don't think we can say that. Outpatient, we've got some increases in the paid member per month. Professional, there's negatives in that first column. Paid per month is down about 55%. So this is an example of how we can dig down if you want to get into the nitty gritty of this stuff. It's not always appropriate for a meeting like this with the finance committee, but we can do that. Let's see here.
Mr. Hunter?
Yeah,
Yep.
just one other question.
Sure.
And this is kind of macro. You may not be able to provide specificity. What impact would you think EAP has on service delivery, especially maybe mental health or something?
Well, I think that's where the real proof would be, to be honest, mental health. And I would have to go back to our EAP provider to garner one of those reports and include it like something, or include it as something we could make a comparison to. So I'm not pawning off your question, but
No, I understand.
I haven't seen one of those reports, to be honest with you. And I'll make a note on my note pages here to ask that question.
Because I think it would have some impact, I would think. Thank you.
On page 12 on circulatory, I do know that this group has a abundance of diabetic and hypertensions, and so I wondered, looking into that, we have a current basis of about 29.6, and the benchmark is about 28.2, so those align up pretty well with what we're being told in the marketplace, is that diabetics are part of every crowd. But on the right side of the page, the hypertension analysis shows that the current mark for this group is about 121%, and the benchmark is about 103. So those two areas, can be looked at and say, without proper medication and proper treatment, those were the big causes of some, circulatory diseases come about. I know a little bit about it. I is one, and you can take care of yourself and leave out a lot of things that will come at you, guaranteed. And if you don't, it's a certainty. But if you don't, there's a lot more things. I'm sorry. Did you have a question?
Me?
Yeah.
No, I was just raising my hand, but I usually want to.
So, in any regard, let's see here. On to page 15. Here, what I wanted to just read you is, you can see between the two time periods, there's 12, now we're at 15, 25% change. But over on the right side, it gives you the verbal analysis. 1.71% were high-cost claimants. Current period, 1.35 going backwards. They accounted for 27.4 of total expenses in the current period, compared to 31% in the prior period, and 42.4 is the benchmark. PMPM for high-cost claimants decreased by 16.9% between the two reporting periods, and was 42% below the benchmark. Paid PMPM excluding high-cost claimants increased by 2.8. Between the two reporting periods, it was 14.3 higher than the benchmark. 16, I just gave you that. There's additional details there for the purpose of reading through it and seeing how much more analysis is there. Page 17, I marked because of the, here we've got top 5 high-cost claimant diagnostic, neoplasms, musculoskeletal, circulatory, blood, skin, and you can see the difference between the two paid. There's one claimant with the neoplasm, 4 musculoskeleton, circulatory was 1 skin disease, and you can see between the two periods that the cancer number is down. Musculoskeleton and all the others are in some cases down, but again, just to have you review that. Page 18 is interesting. High-cost claims listing of the top 15, and you can see it starts out as subscriber, spouse, or dependent, and you can see the total paid and where those numbers are. They're all over 50,000. But again, one of the ones I tend to pay a lot of attention to, and this got my attention real quick because I don't think I've ever remembered this many. There are 2, 4, 6, 8, 10. There's 11 of these claimants that are no longer on the plan. So they've gone off to either Medicare or individual plans, or they've reached the age of 26 and beyond. So they're no longer part of the liability here. And just FYI, 19 outpatient facility overview. You can look at both of those and read that context of the indexes on the right-hand upper page. I'm going to skip to page 22, outpatient provider summary. I always look at this and kind of say that, are your people staying home, and are we getting good value of the services that are available here? And as you can see, Riverside and the outpatient areas had 25 admissions, St. Mary's 12, Rush University, which is an upstream affiliate of Riverside's 4, and you can go up and down there and see where people are going. On the right-hand column, there's the text outlining what percentages there are for that services. Let's see. The same thing exists for inpatient, and I'll skip over to that right now, and that was on page 28. Riverside is also the top number one there. 1,200 and some odd visits, $760,000 of the plan's money was spent there, a total of 42% of the total. And you can see there what the dollar paid is per member per month. President St. Mary's had 462, the paid number, and the percentage of that total, and then down from that. Central DuPage, Renal Treatment Centers of Illinois, it's a pretty big name, Center for Digestive Health. And so you can see who your people are using in that context. I think page 28, and that's really the end of the reporting overview. And so, questions on that in particular? The renewal.
Mr. Swanson.
Yeah, I'm sorry.
I don't have a question on that. Just curious on the medical pharmacy loss ratio. End of 2021, we were 3 digits, and it looks like
The
currently.
page number you're on, can you tell the page number you're on?
I'm on the initial
That's on the first report,
Yeah.
right?
I'm just curious. It says we're currently sitting at 87%. You said the insurance company would like to see us under 80%.
Right.
Is that 80% based on the total collections of premiums for the county only, or is there something else in
It's
there?
based on the medical and pharmacy usage in general, which are pretty much the same thing as the
For
total.
our 412 premiums?
Correct. Yes.
Okay.
Yeah, and that would mean they would look at it as necessarily not a necessity to give you a 0, but it's what's still out there that they see. You'll see in those claimants that if they're still on the claim and it's something that has been there for a year or for a 2-year period, it's likely that it's going to move forward. So that's something that they'll prepare for. And that does have something to do with it. That's a good question. Excuse me. The Kankakee County renewal came in late last night, and I had asked for it as early in August, and you see they got it to me on the last part of August. But they think the projected enrollment, if you look at it, it says at the top, total projected cost by product is going to be about 403. So that's a net number. That's a number that they're just guessing at based on what they've seen. they're projecting the total net claims for next year will amount to about $5,059,000. Illinois facility access fees, which are Blue Cross's discount factors, then their discount percentages, they charge, and we share those dollar amounts with them. Now, in fully funded plans like we have, there is a pooling point, and in this pooling point, it's $110,000. So what that means is up to $110,000, the claim counts against the group's experience. Over $110,000, it ceases to count. So you're not being penalized by that. So the total charge, in addition to net claims, is $6,080,000. Now, here I have to discuss this desired loss ratio. They say is 96.72. Now, I know that they had suggested last year it was under 80% because I saw the calculations. So I'm going to have to beg off on this and ask why they think that the 96% applies as opposed to the under 80%. And I've got a note here to discuss this with them. I've got to call into it because it's confusing to me. I would understand if it was a little higher than it was last year, but I'd like to know what their calculations tell me about that. So I'm going to have to leave that at that right now. So the preliminary premium right now is $6,200,000. The required premium is the same thing. The premium at current rates is $5,600,000. So the required premium at current rates is, they're asking for a 10.3% increase. However, Anita showed me last night that you'll remember after we got through everything last year, Blue Cross came back and gave us what they called a communications fee, which is a discount amount of dollars that they sent to us to stay with Blue Cross, in essence, and it was $100,000 and some odd thousand. So if you back that dollar amount into it, it comes out at 11.1%, I believe was the calculation I saw. So all we're saying there is that Blue Cross is asking us for 10.3, but where we're starting from in terms of rates is 11.1 because we got that cash in from Blue Cross. Now,
Mr. Wheeler.
Just so we're clear, we're starting with that because we passed that savings on to the employee side of things. We just didn't take it ourselves. The employees got that off of their premium. So when we just want to announce that just wasn't gobbled up by us. So accordingly, when we see 10.3 or 4%, you've got to add that back on. That gets us over to the 11.1.
Well, you don't want to be foolish about it because that's the number.
Right.
And I think that, you know, the easiest thing for me to tell you right now is from what I see, there's a lot of work here to do. And the work happens when we get the RFPs out to other carriers, which they went out yesterday. When we got the renewal, which is the final cog in the piece for other carriers, they want to know what how Blue Cross is analyzing this. And so they went out last night at about 5 o'clock, and the two I hope to see come back with something that we can utilize in our discussion with Blue Cross is Aetna and possibly Cigna and United Healthcare. Well, I see some shakes in the heads, and I know people like Blue Cross, but honestly, what all of us want in this business is to have a number you can go back to your carrier with and say, what about this? And so that's, I get that some people don't like what they've had to, I guess it's the hoops you have to jump through with United Healthcare. And I've always said, you know, you'll only like United Healthcare if you, well, I shouldn't say that publicly. You'll like them if you understand the hoops and what they're meant to be. They're there to contain costs. And I know the look I'm getting from this young man up here means I don't like those hoops. So I can only tell you, I hope we get some good numbers out of this so we can come back utilize them with Blue Cross and move forward with a discounted plan from what we've been told at this point. I can't guarantee you that. I never can guarantee you that, but the last couple of years we've been able to make it work. So if there are other questions, I'm happy to answer them.
Anything else? Mr. Chairman.
I think it would, the committee would probably agree, please only entertain offers from carriers who have both hospitals locally. It's immediately disqualified if there's only one, you know. It's kind of a starting point.
Right.
Yeah.
None of those that I remember have network. They have multiple networks that can be used, which both are in. Put
Gotcha.
it that way.
And, I'm sorry, and the research hospitals in
Yes.
Chicago. That's a big part of this too.
You'll remember last year, and I don't know how many people were here for that discussion, Aetna had a network that was almost identical to Blue Cross's. And United Healthcare has a variance of plans, so they have a variance of networks.
Yeah.
And so we can put that on the table, which may mean that we get a competitive or non-competitive number based on those networks.
Right.
So that's another qualifying attribute, so we'll work hard on that.
Are there any other questions? Comments? Well, that was an excellent presentation.
Well,
Thank you for
Thanks for
a lot of
taking,
detailed work.
staying in the moment because I know their numbers. Thank you.
All right. We're ready to, excuse me for a minute.
We should have this conversation. If you could, I'm sorry, go on the mic.
I was just asking the question of what the timelines are, what we needed to do.
Mr. Wheeler, did you want to speak to timelines?
This is the major cog in the budget, major cog in the budget. So as quickly as possible, obviously, but it takes time to go to market. So if I would say a month from now, if we're able to have something back at this meeting next month, that'd be the best thing, because we're going to be doing a lot of planning on budget next month, and we've got to have it passed, obviously, for the Steve, what is that, October? We're shooting for the October meeting, so yeah.
If you don't mind, what we'll do is call back to all these carriers this afternoon and say, we have a revision, and that revision is it must be in the office by, 3.5 weeks from now or 3 weeks. And if they don't get it in, we won't put them on. We'll note it and we'll go from there.
Right. And we'll use the 11.1 on draft budgets to start with now, because it won't get higher. Well, it better not.
I've never seen it happen.
Yeah, you never know.
I've never seen COVID before.
And by the way, we asked Mike for this, and we said we got to have it in August. Thank you for delivering on that. It's a big deal, because then you're not scrambling around budget time to have special meetings because your insurance renewal just got in. And then Anita can do open enrollment when it needs to happen and not have it be in 3 days where everybody's head's on fire. So, thank you.
All right, we move to approval of the minutes for July 27th. Is there a motion to approve the minutes? Ms. Parker, Mr. Swanson, that's a voice vote. If there's no discussion, all in favor say aye.
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 Opposed, nay. We move to the Finance Department. Mr. McCarty. Good morning.
What's that?
Good morning.
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 We start with the normal tax collection, if you will, from sales tax and such. So continue positive trend as far as overall income tax, use tax. So I don't have a lot of specific things to say on any one particular. So I don't know if there's any questions individually or not. I won't spend
Any questions on financial reports or discussion? If not, well, we'll move right along. Cash flow update.
Cash flow. No issues there. We received our first tax distribution actually in August as far as the cash, so that's been the latest for a while. Not that that's a problem, but I bring it up because on our own, not only did we make it through July, there was a 3 payroll month in July, and we did it without any assistance of anything. So just another explanation of, you know, positive trend and positive cash on hand from what we have experienced in the past. So so not a criticism of Nick or his staff, but just the way things worked out, and just looking back at it, you know, I would have been in tears if we didn't have that distribution with a 3 payroll month in the past. So so good news. I don't have much else we're working on. I have this model out through 2025, working on a number of different scenarios going forward and trying to save taxpayer money. And so, as Chairman Wheeler said, the health insurance renewal is a critical piece amongst many things, but that is a critical piece going forward, and see what trend is. So a lot of work behind the scenes going on right now that we'll be discussing soon. So.
Any questions on cash flow? That's very good news. Move to claims recommended, not recommended for approval.
So the first one is for the Public Building Commission. The flow of this one went up. I happened to be up front when it came back. It was manually brought back, and was asked to put a note on there. So I added the note. The other purple markings were not there after it came back the first time. So I identified that because of the IGA, the new IGA, which the board just passed, we made the first 3 payments, first 3 months of payments. Under the previous one, there was no maintenance in 2022, so we didn't have any maintenance connected. So the reason we're in March, April, and May is because this IGA has been going back and forth for 3 or 4 months. So I just waited to make payments until the new IGA was passed, and so that this is the first one. So there is a manual calculation on both the health department and the county's portion to catch up the first 3 months for that. So the claim wasn't even looked at the first time. It was in the auditor's office, brought back, and then the second time it comes back with the markings. With timing of everything, there's more vacation time there, so nobody's going to be around in the office, and all the other things going and trying to get these paid into October. Decided to bring it here and to try to keep things moving and not have to wait another month, depending. So the information is there's 2 manual calculations in built in here. So the new $10,000 admin fee, the previous stopped at 7,000. And in 2022 and on, there were zeros after that. So I plugged in the new admin fee per the new IGA, and then just had to make up the difference. So it's really the 10%. The health department pays 88% of the 10,000. The county pays 12% of the 10,000. So 3 months of that difference is the calculation that got plugged in for both. So checked it twice. It's a manual calculation to just move on. This is a one-time thing, and this particular payment, the rest go to the normal schedule because then it will be on. We've already talked to the health department. They paid us, I believe, 8 months under the previous agreement that did not include any administrative fees, and so we've identified with them what they owe us, because of the new IGA. So we've discussed that with them. So that's the story with this one. Just ask the committee to keep it moving, so we can keep these bond payments going, because they're due on December 1st, you know, and the Public Building Commission makes the 2007 payment on our behalf, you know, because of that intergovernmental agreement. So that's the story behind this first claim.
Is there a motion to approve this claim? Mr. Long? Dr. Polk seconds. Any discussion? Mr. Wheeler?
Thank you, Mr. Chairman. I'm sorry, what was the when the auditor's office called you about this, or you guys communicated, was there any explanations that went back and forth, and any tabulations that were provided, or was it?
I explained, well, when it came back, because there was no markings, she just said, can you add a note, you know, that what's going on? So I did, and I sent it back up. And I had mentioned in person, I said, well, there's manual calculations because we're catching up the first 3 months that were missed because of the new IGA. No other questions, no other requests. So I sent it back up, and then this is how it came back Monday, just the other day. So I had to make a decision on, do we keep going, or, you know, just move it through at this point. So this is the only thing I have at this point from them.
It just came back denied again, not denied, just they wouldn't sign off on it.
Exactly. So
and they're aware there was an IGA that changed those amounts, and you provided those changes in the amounts and the reasoning.
Yeah, no, I didn't provide them the new IGA, then nor did they request it. I mean, it's available to them if they want it. So I did what they requested the first time they had this claim.
Okay.
And this is the note. And then this is the only other communication, the purple, or to you guys, the bottom note, is the only other communication I received on this. So literally no effort on their end.
Any other questions or discussion? If not, we have a motion to pay. Roll call vote, please.
Mr. Lear?
Aye.
Mr. Swanson?
Aye.
Mr. Hess?
Aye.
Ms. Polk?
Aye.
Ms. Weber?
Aye.
Ms. Parker? Mr.
Aye.
Fairfield? Mr. Featherling? Mr. Dunnell?
Aye.
Mr. Miller? Mr. Long?
Aye.
Mr. Hunter?
Aye.
Mr. Raymond? Mr. Wheeler? Motion carries.
And Mr. Wheeler?
Is this breakdown, this PBC refunding revenue bond series 2007, is that all in MIP? Is this schedule in MIP? This is a separate spreadsheet you have on your own?
Yeah.
So there is no representation of this schedule in MIP whatsoever?
No.
Okay, thank you.
All right, the second.
The second one is a credit card activity. There were originally 2 missing receipts. One of the receipts has been found, so I communicated out to Jim Rowe and his staff, and so there was the receipt for JOT form was found. I didn't receive any other communications on the pizza receipt, and so this is here to just get the blessing to move forward. I'm assuming that it's lost since there's no other communications. So,
is there a motion to approve the claim? No. Mr. Fairfield, Mr. Swanson seconds. Any further discussion? Mr. Wheeler.
Thank you, Mr. Chairman. I just want to draw attention to the note on the bottom. It said Johnny's is a usual expense. It seems there's different sets of rules. Apparently, the judges and the county board can't have sandwiches when they're interviewing vendors that we're going to spend millions of dollars with, but the state's attorney, it's okay for him to have pizza. So I just want to draw the dichotomy out there. It seems that somebody's picking and choosing. Thank you.
Any other discussion? Roll call vote, please.
Mr. Lear?
Aye.
Mr. Swanson?
Aye.
Mr. Hess?
Aye.
Ms. Polk?
Aye.
Ms. Weber? Ms. Parker? Mr. Fairfield? Mr. Featherling?
Aye.
Mr. Dunnell?
Aye.
Mr. Miller? Mr. Long?
Aye.
Mr. Hunter?
Aye.
Mr. Raymond? Mr. Wheeler? Motion carries.
The total, any other questions there? If not, the total monthly claims report is in your packet. Is there a motion to approve monthly claims? Ms. Parker, Mr. Featherling seconds. Any discussion? Any items you wish to discuss? If not, roll call vote, please.
Mr. Lear,
Aye.
Mr. Swanson,
Aye.
Mr. Hess,
Aye.
Ms. Polk,
Aye.
Ms. Weber,
Aye.
Ms. Parker, Mr. Fairfield, Mr. Featherling,
Aye.
Mr. Dennell,
Aye.
Mr. Miller,
Aye.
Mr. Long,
Aye.
Mr. Hunter, Mr. Raymond, Mr. Wheeler. Motion carries.
All right, we move to ARPA funding requests. There's nothing under lost revenue I see. Under the ARPA section, if I might for a moment, I'm going to suggest to the committee the following procedure, and if there's unanimous consent, well, we can use this. We'll ask Mr. McCarty to discuss each item, take a quick voice vote on the individual items, and then at the end, after we've gone through all the items, we'll have a motion to combine and take a roll call vote. If there's unanimous consent on that, we'll follow that, and then we won't have to do a roll call on each individual item. Seeing no objection, let's move forward and go with each of the individual items. Review.
Right, all right. Radulovich Enterprises, doing business as Wellistics Infrared Sauna Studio. This is the second time for this business. So this is the 2020-2021. We did review all their tax documents. It's under the 10,000 small business assistance cap, so 50% reduction within the municipality, so they are eligible for $5,000.
Motion to approve. Because we're going to take a motion on each one, a quick voice vote, so we don't have to, so we're clear that the individual items were approved. Mr. Featherling, Mr. Long, if there's no discussion, all in favor say aye.
Aye.
All right, we'll move to the next item.
Yankee County Health Department, this is a request for parking lot repair assistance. The request was $450,000. I believe Chairman Wheeler will expand on that. The code that we're using is 1.14 for capital investments in facilities that respond to public health emergencies, direct COVID, on a reimbursement only basis. Chairman Wheeler, did you want to say anything on this one?
Just briefly, thank you, Mr. Chairman. Had conversations with obviously Mr. Carrico and as the president of the board, board president of the health department, and then also Mr. Beavis. They've got roughly more than double this amount in total parking lot work, and they asked for a little bit of help doing that. It fits into the ARPA proper category, the kind of the hard to spend money. It has to be based on something that is exactly what this is, people accessing health care, whether it's shots for COVID, but also other types of health care. So it fits into that category of the hard to use dollars, if you will. So I thought it was well within our purview to help out this. While it's not the county board managed, it's a connection of the county. So that's why I thought that, yeah, I'll bring it forward under 150 and then we can talk about it in committee.
A motion to approve. Mr. Hess, a second. Mr. Swanson, all in favor say aye.
Aye.
Opposed, nay. Next item.
All right, Sumner Township requested $25,000. They are under the cap of $20,000 for non-covered government. The request was for since they also use the building as a polling place for, they're looking at a standby generator. Is what they're looking to do. So they're eligible under reimbursement only for $20,000.
Motion to approve, Ms. Parker.
Donnell.
And Mr. Donnell. No discussion. All in favor say aye.
Aye.
Opposed, nay. All right, next.
Roman Township requested $20,000. They're eligible for $20,000 under the non-covered government cap fund reimbursement. Their request is to make a bathroom ADA compliant and shower, build up floor for wheelchair access. Well,
Ms. Parker moves to approve. Mr. Hunter seconds. All in favor say aye.
Aye.
Opposed, nay. Next.
And then St. Anne Fire Protection District requested 45,000. They are eligible for 20,000 under the non-covered government cap fund reimbursement. Per the letter and information and the application, they had a fire, and apparently one of the fire trucks was not covered by insurance, so they're trying to replace things along that line. So that's what the basis of the request is for.
Motion to approve. Mr. Long, is there a second? Dunn. All in favor say aye.
Aye.
Opposed, nay. Motion carries. And that's all, right?
That's all I have.
Could we have a motion then to combine all of those for approval by roll call vote? Mr. Featherling, Mr. Swanson, any discussion? Ms. Weber?
Great. Thank you. My question was, what are they all in the same year? Were they all 2021 or are they 20?
Well, we're using up the 1920 first.
That's what this is?
So the business is the only one at this point that is the 2020, 2021.
The first one is the one. So that's why it's an additional amount, because they already used the last one. So we're going into the new year for them.
Well, because they're second time through, and we're looking at different years of comparison from the first time through. So.
Thank you. What you just said is the four bottom ones are from the 1920, and the first one is 2021, and they did receive money the 1920.
Yes,
okay.
That is a good question, and the non-covered governments actually could cross with once all of them come. I did not actually look and calculate that. So that's a good question. I'll follow up on that.
Thank you very much.
Yeah, we might be crossing over with, because they're all at 20,000. I think we're at like 76,000, if I remember right. Those could actually cross by the time they all are paid out into the new segment of.
So 21. The motion's still okay, isn't it? You're just
yeah. Since they're both eligible, since it's all there, we're the businesses, especially the second time through. If somebody's coming for a second time, we're definitely looking at that separately.
Mr. Wheeler,
Yeah, it was just to mention that if, that we had the first round of COVID and that was allocated there, the second round will be allocated to the second round. We're just not going to use up the first. We're going to keep track of which buckets are where they're at. We remember as a committee, we had said these will all end, at the end of 11/30. So, we want to keep an accounting, because then that funds will shift back over into lost revenue. So just as a kind of an awareness thing, that really doesn't matter for the health department, Sumner, Roma, and St. Anne, because it's not based on their tax returns. They don't have them. That's project based. I hope that makes sense. So we're not, we're going to put them in the appropriate bucket. And I think we're dealing right now in this year. I don't think there'll be anything that goes backwards for those. Would you agree, Steve?
That's not what he said.
Because the work is going on now. It's reimbursement that would happen now. It's not based on last year's financials.
Yeah, no. Well, yeah, the non-covered government requirement by the Department of Treasury isn't necessarily that it has to be a financial impact. There's a percentage of their budget, so it's more wide open for non-covered governments if we, just say if the county board decides to, work with them. So as far as the buckets, yeah, we have been using, whether our understanding, it might be different what the chairman just said, was, no matter what purpose, we've been keeping track of non-covered government and what we've paid out to them. In that, I just forgot to look to be able to answer that question for you, to where we're at, in the two buckets that have been approved. So, but yeah, we're definitely keeping track of it, and the different businesses. We're a little bit behind right now because I'm a third down and help. Devlin's out on paternity leave here, so we're desperately needing him back whenever, which I believe is at the end of the week here. So But we are definitely keeping track, and all this flows into our reporting, with the Treasury, so.
Other questions, discussion? We have a motion, right?
Yes.
Roll call vote, please.
Mr. Lear?
Aye.
Mr. Swanson? Mr. Hess? Ms. Polk? Ms. Weber? Ms. Parker? Mr. Fairfield? Mr. Featherling? Mr. Dennell? Mr. Miller? Mr. Long? Mr. Hunter? Mr. Raymond? Mr. Wheeler? Motion carries.
Is there anything more for your department?
That's all I had.
All right. We move from the finance department then to the treasurer's office. You have the treasurer's report on monthly resolutions. Is there a motion to combine and approve? Mr. Hunter, Mr. Miller, any discussion on the reports? Voice vote. All in favor say aye.
Aye.
Those opposed, nay. Motion carries. Nothing from the auditor. He's not present. No representative from his office. Is there any other business come before the committee? Any old business? Any new business? Mr. Hess? A motion to adjourn. Mr. Long, I saw his hand first. Seconds, all in favor say aye.
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 Opposed, nay. Motion